All right, thank you very much for joining the admissions talk for the Bachelor of Arts and Sciences in Global Health and Development program. So the JUPAS code is JS6250. So I am Dr. Yeung, Assistant Professor at the School of Public Health, Faculty of Medicine, University of Hong Kong, and I'm also the admissions tutor of this program. And together with me is Dr. Andrew Park, who will be talking to you a lot more on the placement, which is one of the unique components of this program. So let me just give you a very brief background about what global health and development is. So when we talk about health, in the past, people might think about health as clinical medicine. So meaning that practicing as a nurse, practicing as a physician, or practicing as a pharmacist. So that is also important. But then, I mean, this is more about treating patients when they were ill. So therefore, afterwards, people think about health as public health. So public health focuses a lot on maintaining population health, meaning that we devise policies or interventions to improve the overall population health. For example, thinking about preventing cancer. So preventing lung cancer is a key priority in public health measures. So what we are going to do is usually promote high taxation so that people smoke less. So that is more about prevention. But how about global health? So global health is sort of more recent term developed in the field. So when we think about global health, this is more about having a global view on the health in the entire planet. So this is not just talking about health in a particular city, in a particular country, but instead the health of the global population. And this is increasingly important because when we think about health issues, these things often transcend across borders. So think of the COVID-19 pandemic, which we have experienced in the past 3.5 years. It's difficult to really say that this is your health problem, but not my health problem. Eventually, the disease actually spread across the entire world. So therefore, this is no longer a public health problem. It's always considered as a global health problem. And this is what we exactly wanted to teach you about when you study global health and development. So one of the other example of global health example is World Health Organization. So World Health Organization try to ensure that all the countries in the planet act together to mitigate against risk. There are a lot of issues with this. For example, thinking about COVID-19, even WHO proposed certain interventions. There are a lot of reasons why some countries follow the regulation, whilst others would prefer to have their own approach. World Health Organization does not only deal with things that are directly related to health. So recently, the Director General of WHO actually made a comment regarding the Israel-Hamas conflict, saying that they have to cease fire in order to protect health of the population. Therefore, this explains that a lot of the things maybe originally it might be thought of as something that belongs to a particular discipline, like climate change for environmental science, the conflict that I just mentioned belonging to a political issue, ultimately it affects health. So therefore, in order to fully understand global health and development and to come up with solutions to deal with it, requires you to really understand different perspectives when we investigate or understand these issues. So COVID-19 has been discussed a lot of times in the past. For those who have followed our Twitter or Instagram, we have been using COVID-19 as an example, demonstrating the complexity of global health and development issues. But as this cartoon mentioned, COVID-19 is really bad, but people argue that climate change is even worse. But unfortunately, different countries have their own interests, and therefore they might not want to have a concerted effort to deal with this. And similarly, we have the Sustainable Development Goals proposed by the United Nations, trying to provide signposting regarding what the countries can do to make our planet a happy place for our next generations. And there are a lot of goals that we have, but because of conflicts between countries, as well as the COVID-19 pandemic, a lot of the progress that has been made by the different countries has been sort of delayed or even reversed due to these global health issues. So another example would be antimicrobial resistance, so meaning that the bugs become resistant to the medications that we use. So in WHO, again, they mentioned the quote saying that vaccine development is expensive and scientifically challenging and are associated with high failure rates. For successful candidates, complex regulatory and manufacturing requirements often exist, and we have to leverage the lessons of COVID vaccine development and the speed of our research or search for vaccines to address AMR. So you can see that there are a lot of things that we can learn from the past regarding global health crisis. And the most important thing is how can we actually adopt and to learn from this mistake. It's good to have these recorded, but if we don't learn from history, then there's a say that history repeats itself. So that's very important. So other examples why we need to have different disciplines to understand global health issues. For example, vaccine effectiveness. How do we conduct sound epidemiologic studies? So that's the basics of public health, epidemiology and biostatistics and sound research methods. But apart from having the evidence saying that this vaccine works, for example, back in COVID-19, we have the BioNTech vaccination, we also have the Sinovac. So why do people take one rather than the other? What are the evidence saying about this, and whether people are making rational or informed choices regarding what they want to do? So that leads to the concept of vaccine hesitancy, and that's more related to social science, studying human behavior. Apart from that, we also need to think about economics. So how would pandemic actually affect not just the health of the global population, but how does it actually influence the world economy? We have the vaccines. We also need to think about how to distribute it equally. So that's the concept of equity. And most importantly, we have politics involved. So why do the government promote certain policies rather than the other? Obviously, it's partly based on evidence, but probably it's also partly based on politics. So therefore, in this program, if you are enrolling into this study, in this program, so what you're going to learn is what is public health? Why is this a public health or global health? Why is it a global health problem? And where do we find and see this global health problem? And when did we observe them? Who are involved? Who are the stakeholders? And how, most importantly, how can we deal with these global health issues? So therefore, university has advocated the importance of interdisciplinarity in the curriculum development. And therefore, our title is a bit different from the conventional bachelor degrees, which is called Bachelor of Arts and Sciences in Global Health and Development. The reason why it is described in this way is because the university wants to emphasize that this program focuses on interdisciplinarity, meaning that for global health and development issues, we don't want the student just learn about the science, but also be able to understand the same topic from different angles, and hence the word BASc. And if you have walked around the campus, you will notice that there are a couple of BASc programs like FinTech or Design Plus. So they are all reiterating the importance of interdisciplinarity within their own particular field. And in this program, we are focusing on global health and development. So this is an interdisciplinary approach in curriculum development involving 6 faculties in Hong Kong U. The mode of learning obviously includes lectures, standard lectures, but also with tutorials, problem-based learning, and for advanced courses, these will include seminars, because ultimately what we want the students to know is not just knowledge from the book, but also be able to communicate and to assimilate the knowledge and translate it into something that is actionable. So for the BSc program, the university emphasizes a lot on the importance of this program to train respective management or leaders in those fields. So therefore, for the BASc students, including the ones who are taking BASc GHD, they will need to take courses relevant to management and leadership, including leadership courses, how to become an effective leader, understand the meaning of big data. I mean, it's all over the place, big data, AI, so on and so forth. So big data is something that you have to understand at least. And also, how do we understand knowledge beyond the discipline that you are working at? And most importantly, which Dr. Park will discuss afterwards, is the 6-month field placement facilitated by the school. So what are you going to learn in GHD? It sounds like there are a lot of things that you can learn. So in the curriculum development, we actually paid a lot of attention to what are the critical components that are important for you to understand and to come up with solutions to deal with global health and development challenges. For example, public health, which is the 4th item in the slide, is obviously very important. You have to understand epidemiology, understanding the distribution of disease in the population to identify a problem. You need to understand what is the global burden of disease and what are the sound research methods, and also say health systems and healthcare financing, so on and so forth. But apart from this, you also need to understand perspectives or the contributions that can be made by other disciplines. For example, economics. We know that economic workforce or the force of economics actually shape a lot of the policies that we are doing. So you have to understand what is the meaning of micro or macroeconomics and what is the meaning of finance. For law, a lot of the things are governed by regulations. So you can't just come up with a solution that does not follow the rule of law. So therefore, you need to also understand global health law and human rights. What do we mean by human rights? If we ask people to wear masks, does it violate human rights? People might have different perspectives. In Hong Kong versus in US, we can see that there are very, very different reaction towards the same implementation during the COVID-19 pandemic. We are dealing with people, so we need to understand social science, which includes population, development, as well as political economy, which is very, very important driving force of all different kinds of policies. There are things that might not look like very direct, for example, architecture. But think about in Hong Kong, we are living in one of the most densely populated cities. And if we are developing our urban areas very poorly, then obviously this will also impact the health of the people residing in these areas. So therefore, there is a term called healthy cities, and this is what people are starting to talk about in the context of global health. And lastly, we need to deal with science, so therefore we need to understand statistics as well. So this will be complemented by both the BASc core courses on big data as well as the in-house course offered by the School of Public Health. So apart from these, there are courses that are more advanced and more integrated in a way. So these include topics such as health systems. What are the different health systems between countries? What is the impact of globalization? Is it just simply about people being connected more easily compared to others? How would that impact the health of the people? For example, wider spread of unhealthy products because of wide-scale advertisements, easier logistics so that unhealthy products can be easily transported from one place to another before and after globalization. How do we ensure governance? A lot of the time there have been a lot of say, but how can we ensure people can actually do what they are suggested? So these are really complex issues where we don't have a concrete answer, but we provide you with the context and the necessary knowledge for you to make a guided judgment on this. And lastly, we are training leaders, so therefore there are courses allocated to leadership and advocacy. So this is a very generic diagram or table showing the BASc curriculum. So in each year, we have an anchoring course. We understand that students might get a little bit lost when they're taking courses offered by different faculties. So therefore, in each year, each student, there will be a course which is called anchoring course offered by School of Public Health to help you link up the thing that you're learning between different disciplines. So including foundations, globalization, health policy, so on and so forth. We also have compulsory course offered across the years to help you understand key concepts, including introductory economics and finance, epidemiology, biostatistics, research methods, as well as health economics and evaluation. And to provide flexibility, we understand different students might have different interests within the scope of global health and development. Therefore, students can choose freely within the disciplinary core courses. These are courses offered by different faculties, and you can choose according to your own interest to enrich your overall portfolio. And for the BASc program, which JC is one of it, you will have to take 3 core courses offered by University Central, including data science, sustainable leadership, as well as understanding knowledge beyond disciplines. So I think a lot of the details can be found in the booklet as well as on the website. But if you have any questions, feel free to drop us an email or talk to our staff after the admissions talk. Let me just give you a little bit more on JUPAS admissions. So I presume most of you are going to apply for university based on JUPAS admissions. So this means that you're applying on the strength of HKDSE, Hong Kong Diploma of Secondary Education. So what you need to do is to really fulfill the requirement, which is very straightforward: English level 4, Chinese level 3, Math 2, and attain the citizenship and social development, and then do 2 electives. So candidates with level 4 in English, if admitted, will be required to take 6 additional credits in the core university English to complete their degree studies. So meaning that for these students, they will need to take 246 credits instead of 240. The reason why that is the case is because this program will require students to really go to overseas to do their field placement. So you have to demonstrate sufficient English competencies in order to help you get the most out of the field placement. So the students from all disciplines are welcome. So global health is a multidisciplinary subject. Therefore, in terms of the selection, we also use the same logic, meaning that we do not discriminate or we do not put more weights to people with certain backgrounds. So regardless of whether you did your biology or whether you did business or you did other subjects, all disciplines are welcome, and preferences will be given to candidates who put us in Band A choice 1 to 3 in JUPAS. And the interview will be in June, July 2024. So as you know, the JUPAS admissions require use a bonus point system in Hong Kong U. So the existing score system is 1 to 7. So that is equivalent to the grade 1 to 5 star. But if you apply the bonus point system, then that becomes like 1, 2, 3, 4, 5.5, 7, and 8.5. So essentially that will put more weights to students who achieve a higher grade in particular subjects, sort of like a rewarding excellence in particular areas. So in the BASc GHD program, we will take the best 5 subjects when we consider whether a candidate is eligible to be enrolled into the program. All Cat A arts, sciences, and commerce subjects are equally weighted, and M1 and M2 are recognized, and there is no specific elective subject requirements. So what I want to emphasize is that our program is not very large. It's talking about 20 to 25 students every year because of the field placement arrangement. But that doesn't really mean that we will not recruit students which we think are suitable. So to debunk one of the sort of maybe misconceptions regarding admissions in our program, in the past, we tend to receive more students from the non-JUPAS, but that doesn't really mean that this is our policy. We do not have a set ratio for JUPAS or non-JUPAS students. So meaning that as long as you fulfill the requirement, and if you have satisfactory interview performance, then we will accept you into the program. So in the booklet in front of you, we already set the expected score, which is 27 after bonus for best 5 subjects. So as long as you attain this score, 27, best 5 after bonus, and if you put us as Band A1, then you will be likely to be included and enrolled in the program. So don't be scared to see that, oh, how come we are only receiving so few JUPAS students? The reason why I make this point clear here is because we do not want to let you be afraid that we are trying to make a very, you're trying to apply for a program which has a very low odds of being admitted. So to be clear, as I said, as long as you have the best 5 subjects after bonus 27 for DSE, and if you put us as Band A1, then you will be admitted very likely into our program. Okay, so this is based on our past 4 years of experience in admissions. So please don't worry. If you have any questions about admissions, drop us an email and we are more than happy to clarify. Just to make clear, we have the interview. So make sure that if you are interested in the program, please make sure that you put us as one of the choices in your Band A, because that's usually how we come up with the invitation to the interview. If you don't put us as Band A, it will be difficult for us to give you an interview before the release of the DSE results. But we will also provide interview opportunities if after the results are released, if you put us back into the Band A to 1 to 3, then you will still be given opportunities to be interviewed. So as long as you put us as Band A, then that's one of the key criteria for you to be chosen to our program. So a waiver of the university entrance requirement will be granted to JUPAS applicants who unfortunately failed to meet the UER by 1 level in 1 subject on the condition that the applicants cannot fall below level 2 for any subject stated in the UER. The applicant's total DSE score, unfortunately, will be deducted by 10% to take into account of this. And in addition, applicants have to include the program concerned as one of their Band A program choices, have a positive interview outcome, and fulfill any additional program entrance requirements. So this is more or less very similar to the arrangement of other programs. So we have scholarships to sort of encourage people with high academic caliber to join the program. So we have the entrance scholarship. So this is applicable to local candidates. So if you are applying through JUPAS, then you will be eligible, and there will be up to 6 scholarships to be awarded at the value of 10,000 each. So the value is not large, but I think the more important thing is to recognize your academic performance. We also have the Medical Dean Scholarship, and you do not need to apply separately. You will automatically be considered, and that is slightly more. So it's 15,000 per scholarship. And we also have the generic, like university-wide HKDSE top 1% scholarship. And that's all about the admissions and a brief account of what it's about global health and development. I've seen a lot of familiar faces in the morning. It's good to talk to you. And hopefully you have also met Professor Bishai, our director, and it's good to see the dean here supporting the program. Thank you very much. And now let me pass the floor to Dr. Andrew Park to really focus more on the field placement, career, and Hong Kong U Life, which is very important. Thank you.
Great. Thank you, Dr. Yeung. Okay. I thought you wanted to say a few words. You can if you'd like. All right. All right. So my name's Dr. Park. I'm the coordinator for the field placement component of the GHD program. And I apologize, first of all, that I didn't get the memo about the shirt. I haven't picked up my appropriate nice uniform yet. But I want to start when talking about the field placement by asking the students in the room a question. Raise your hand if you want to make a difference in the world. Good, good, good. This side wants to make a difference. This side's not sure. Okay, I think it's pretty clear that most people want to make a difference. You're students, you're young, you want to make a difference. And that's fantastic. And that's presumably why you're here thinking about this course. My question, though, is how? How are you going to make a difference? Well, this is not a lecture, so don't worry, I'm not going to, quiz you more. But this is precisely why the field placement component is integral to this program. Because it's one thing to say, I want to make a difference, I want to change the world, I want to make the world better, but there's the real question of how you do that. And it's very difficult as a young person, as any person, as an individual, to change the world. That's why you need to be kind of involved in some form of organization. Usually the backing of an institution, a non-governmental organization, an organization like the United Nations, corporations, and so on. This is how you change the world. If you're part of something bigger, this is something that enables you to kind of enact change upon the world. And that's why the field placement component is integral to the Global Health and Development Program. So what exactly is this field placement component that I'm going on about? Well, it's a chance for you to really do hands-on work in some meaningful projects related to global health and development around the world. And I'll show you in a moment where we have our students at the moment. The aim is to be exposed to real-life challenges and to actually be part of a team working on projects that are making a difference. You're trying to basically integrate and use the knowledge you've learned during your GHD studies in your final year to actually do something, to actually put and implement this knowledge and also learn from experts and professionals who are in the field. It's basically translating the theory, the knowledge you learn, into some kind of practice, something that also helps you on your next step in the job market, the next step in your career. Okay, so that's why we have the field placement. What about some of the details? Well, it's 6 months of full-time work. You are working fully. You're not doing other courses. You're placed in an organization and you're doing the 9 to 5 or the 9 to whatever is the work environment of that organization. You are embedded with the team. You have a supervisor, of course. You also have to, do some reports to myself and colleagues about updating us on what you're doing, and we follow this. But essentially, it's full-time work. It's essentially a full-time internship with an organization. And you're getting some insight into how the world is really working, how organizations are really coping with these challenges. It's facilitated by the School of Public Health, and I can touch on that in a moment as well, but this includes, when I say facilitated, this means that we have a number of partner sites where we have agreements, where we can help, facilitate students going to some interesting organizations, but we also encourage students, if they have, say, an organization we don't know yet or we haven't reached out to, and we think it's really critical to global health and development, we want to help get you there. We want to help reach out on your behalf to try and open up doors for other organizations. So this is what we mean by facilitated. There's also some enrichment scholarships to support students during their placement. Where are our students on their placements? Well, the GHD program, first of all, is a pretty new program. We've just had our first cohort graduate this year. This means that we've had 2 cohorts doing placement, one that did their placement last year and one that's currently out on their placement. And these are on the map here. And I don't know, it's particularly large font size for you to see, but I can run through some of the organizations and places where students have gone. We've had students with the United Nations, with United Nations Headquarters Statistics Division compiling reports on economic and social affairs, UNICEF, the UN organization dealing with child welfare, and the UN Development Program. But it's not just in New York. New York is, of course, the headquarters of the United Nations, but we also have the United Nations Development Program has projects in about 180 places around the world. So we had last year a student in Istanbul working for UNDP. This year we have a student in Sao Tome and Principe, which is off the west coast of Africa there, also working for UNDP. Same for Indonesia, Jakarta this year. But of course, it's not just the United Nations. This is what Dr. Yeung was saying in his presentation about global health. Global health is not just one thing. It's a whole range of organizations working on different projects which are interrelated. So, that being said, we have a lot of NGOs, a lot of non-governmental organizations which are working on a whole range of projects. China Medical Board, a project operating in Thailand, Thai National Health Foundation, Community Partners International. I just was in touch to one of our students there who is based in Bangkok at the moment for her placement, but was visiting the Thai-Myanmar border to look and facilitate, refugees from the civil conflict in Myanmar. So really a range of impressive things that our students have done. There's also aspects of corporate and clinical research aspects. So we have students in Taipei who are working for Amarex Clinical Research. This is an organization which is trying to get drugs approved for other markets. To get a drug accepted, you have to do a lot of research and testing and approval and so on. And this is an organization which is helping do that. So there's the corporate side of global health, which is also important. Then there's also the International Federation of the Red Cross, one of the biggest networks of humanitarian relief organizations. We have students in their headquarters in Geneva, but also their regional office in Kuala Lumpur. I could go on and on. We've got so many exciting stories. And as the coordinator, of course, I have a tendency to go on. But I want to share some examples from the students themselves. Now, if you haven't seen this page, you can scan here and see our field placement blog. This is the blog where our students, when they're out on their placements, they have to share their experiences. They have to maybe produce a short video, show some pictures, some text about what the kind of amazing, exciting things they're doing. And so we've got a whole range of here from last year and from this year. And there's so many things I could share. Edward Ye, for example, is in China CDC, China Center for Disease Control in Beijing. This is the national body, which is trying to deal with China's huge range of public health epidemiological problems they're trying to tackle. And he was also playing a role facilitating visits by medical expertise from the African Union to China. So already another aspect of global health. Then we have Andrea Chan working for the GX Foundation. This is a Hong Kong-based medical kind of NGO, humanitarian organization that organizes cataract surgeries in Laos and Cambodia. So for villagers who have cataracts, it's a simple surgery. They could change their life, and this organization goes and helps facilitate that. And suddenly, these people have a new walk of life. A whole range of stories. Kelvin from the Red Cross, Dixon in HealthServe in Singapore. The point I'm trying to make is that we have a high number of places and students doing exciting things on their placements. So if you haven't, take a look at our field placement blog, and don't listen to me talk about it, but you can read and see their stories there. So that's the placement, but why is the placement important? Well, obviously, and I'm sure the parents in the room have this, strongly in their minds, is that the university, you don't want your student, your child to be in the university forever. The aim is to get them a job, to get them working, to get them having a foot in the door in a competitive global job market. And the placement provides a pretty important kind of first step into this job market. In fact, the whole GHD program provides this. What are some of the careers that you might be interested in after doing the GHD program that the placement might help set up for you? Well, there's a whole range. There's technical, strategic areas, there's leadership areas, there's policy making as well. You could be an analyst, for example. You're learning critical research skills to not just think about a given topic, but to evaluate the type of evidence you're looking at. This is especially important in this world of AI, where we have so much information, but critically assessing the quality of that information is even more important. So that's a foundational skill you will get. You could be a consultant, for example, in a lot of these large consultancies, helping out across the world in a range of organizations. Management, executive level careers open up. Program officer, running various programs, administrating projects. A whole range of job functions you could do in a whole range of organizations. Of course, there's governmental, supranational organizations. There's the World Health Organization we mentioned, the United Nations. But a lot of our students, have careers at either overseas in their home country governments, or in the Hong Kong government, or in the United Nations as well. Management consultancies, a whole range of potential options open up. I can just add a few words. Because we just had our first cohort graduate, we now have some evidence about what our students have done. And I would say about a third have gone on to do master's degrees, some in LSE in London and other really great universities as well. But a lot have got jobs. We've got a student working for Pfizer, the pharmaceutical company. We've got someone working for Médecins Sans Frontières, the Doctors Without Borders, the humanitarian organization. A whole range of kind of career opportunities as a result of the program. Which also makes me point out, well, what are some of the skills viewed from the employer's side of things? What kind of skills do people who will hire you want? And we can look here, and I don't think it's changed too much, but in 2020, you can see here, complex problem solving is one of the top kind of skills. And that's exactly what the Global Health and Development Program is about. Because as Dr. Yeung mentioned, you can't tackle any of these problems without kind of thinking how it relates to something else. How do you stop people smoking? Well, obviously you could pass a law, but then that's not enough. How do you use social science to understand why people smoke in the first place? How do you do psychology? And how is all these things? How is advertising linked to this? So complex problem solving is a skill that employers want, and it is definitely something that the GHD program will provide you. critical thinking, creativity, all of these components, very related, and something that I think sets the BASc program as a whole and the GHD program in particular apart. All right, I've already gone on a little bit about that. I want to look at the GHD program and the placement as part of your broader career as well. So one thing which we haven't mentioned about the placement program is we also incorporate workshops, things that are looking ahead to your career. For example, we had a few weeks ago a workshop for third-year students about how do you prepare for interviews, an interview skill workshop where you run through the basics, have practice interviews. The same with CV writing, these kind of basic skills that the GHD program is also trying to integrate into its studies. So how do you write a great CV? How do you stand out with a great cover letter? All of these kind of basic things. But it's also about looking holistically, looking long-term about your job. And I think this is why the GHD program is so important, because you can point to a whole range of knowledge you've learned. You can point to the field placement where you've actually learned practical knowledge. All of this is really useful in building your CV, and we think giving you an advantage when you go out into the job market after you've graduated. All right. I'm also going to talk to you about life in HKU. I've gone on about the placement. I've gone on about our program. Of course, it's not just academics. It's not just that you're involved to learn from 7 in the morning till midnight. Probably not a great move for your sleep. But there's great opportunities that HKU provides, and also the GHD program. We have a number of students here who are volunteering, and some of them are actually members of the GHD society. So there's student societies. Students have created on their own societies to promote discussion about global health and development, promote other students from around the campus understanding what is global health. There's a whole range of others, of course, as well. There's university halls, hall life. You can live in a residential college. You can contribute to university that way. I know a number of students do. And there's also sporting things. Frankly, I'm not that qualified to talk about the sporting side of HKU, but apparently we have lacrosse, softball, and hockey, and a whole range of activities. But there is one thing that I can mention, also linking back to global health and development, is that we're based in the School of Public Health, and we have a really tight community, and students benefit from that. I think we have just created the hiking club. I think there's also been a number of hikes between students and staff and so on. It's a very collegiate atmosphere. Dr. Yeung mentioned that we only have around 20 to 25 students in each cohort. If you think about it, that's a very good ratio of staff to students. You actually know your students. You get to know them. You get to know what concerns they have, what motivates them. And this goes not just for academic life, but for social life, going on hikes, going on, promoting talks for various things to expand students' horizons. So that's definitely something that I think is very good about the School of Public Health and the Global Health and Development Program in particular. I will probably wrap it up here. We have some contact information. There's, of course, our website. We have Instagram, which is always exciting. We've got our email. Please reach out, have a look. Our field placement blog as well. You can read the stories of our students. And I think we can take some questions now, Dr. Yeung and myself.
Yes, so thank you very much again for Andrew to present very detailed description of the field placement. That's the unique feature of the program, and that's one of the main reasons why a lot of students chose GHD. So before we take questions, may I invite the Dean, Professor Lau, to just say a few words, as well as Professor David Bishai, the director of the school, to just give you maybe a brief account of why that's important, and then we can take questions afterwards. So please, thank you.
Well, I'd like to welcome all of you. I want to welcome our prospective students and our parents to Hong Kong. I'm a little bit new here. I just got to Hong Kong 6 months ago after 25 years on the faculty at Johns Hopkins University School of Public Health. I love this program. It's one of the reasons I took the job in Hong Kong. My background is in both economics and medicine, and I realized that it's not enough just to be a clinician and see patients. We have to create the conditions for health, and that requires economic development. We have to know how to fight poverty. We have to know how to get girls in schools. We have to know how to create jobs, and we have to distribute vaccines and primary care. So this ability to learn how to learn gives you the ability to keep learning throughout your job. And as Ryan and others have said, we're small enough to get to know you. I'll be having coffee with every single one of my first-year students. I'm in the classroom with them twice a week. We're teaching global health and development, and we learn about poverty and women and health and why life expectancy has gotten so long. So it's a terrific foundation for a career in Hong Kong or a career all across the globe. It is really one of the shining stars of the Faculty of Medicine's programs. I'll turn it over to the Dean.
Thank you, David. Okay. Now, first of all, may I ask if all of you speak and understand Chinese? Is there anyone who actually does not understand Chinese? Then I can talk to you in Cantonese, the local language, so that David and Andrew won't understand what I'm talking about. But I can assure them that, in fact, whatever I say is actually about how good this program is and how good our School of Public Health is. It's just that I think it will be better if this is global health， 全世界都係咁，我哋中文、英文、中國、英國，全世界都會包含到。咁首先好多謝你哋先，多謝你哋今日咧嚟有興趣睇同埋多啲關於我哋呢個嘅BASc GHD 呢個 program。咁咧我唔知大家識唔識我叫做劉澤星，咁我係一個醫生嚟嘅，其實我係一個嘅專科醫生嚟嘅。咁我不嬲我都同好多人講咧，其實我做咗一個專科醫生風濕免疫科好多年㗎啦。如果我有機會，我會將我嘅事業改變。我會讀咩科咧？其實有兩個科我會想希望讀。第一個就係公共衛生 （public health）， 第二嘅就係家庭衛生、家庭醫學 （family medicine）。點解嘅就係咧？當我發覺我自己一個嘅專科醫生之後咧，我發覺其實我可以幫到我認識嗰啲病嘅病人好多，但係其實呢一個世界咧，其實不是淨係風濕病，有好多不同嘅病。而我哋喺研究呢個風濕病嗰方面咧，我哋做咗好多嘢，我哋要好大嘅力量，我哋可以改變一班或者一撮嘅病人嘅病情。但係喺公共衛生，我唔講家庭醫學先，其實就唔係啦。大家諗諗，我哋公共衛生嘅專家可以知道，譬如話運動對我哋嘅健康有幾大嘅正面影響，我哋食少一支煙對我哋嘅健康有幾大影響。當我哋嘅公共衛生嘅專家話俾我哋聽，我哋喺我哋嘅醫療政策嗰度點樣需要改呢樣或者係改善呢一樣，我哋可以將我哋全體嘅人類嘅健康都會提升，其實就唔使我哋呢啲所謂專科醫生嘅。所以我要做公共衛生，因為我知道我將來可能冇工做，冇乜生意。唔係，其實真係講認真嘅，就係公共衛生係一個好緊要嘅一個嘅範疇。其實即係我哋呢幾年，我哋呢個嘅 COVID 呢個新冠病情咁嚴重，其實有好多都當然我諗每一個人都好多嘅力量落去嚟到將我哋個疫情係慢慢扭轉翻嚟。但係其實好多嘅事情都喺個上面公共衛生嗰度，嗰啲政策點樣可以防止嗰啲病毒去傳染，點樣可以利用我哋嘅疫苗去減低我哋嘅病人嘅感染嘅機會，或者係感染咗之後有幾嚴重。 所以公共衛生係好緊要。咁而公共衛生頭先講啦，因為即係全人類全球嘅，不是淨係香港嘅，所以我哋嗰個嘅課程咧就真係好着重咧，係讓我哋嘅同學有不同嘅方面、不同嘅地方都有我哋嘅所謂 exposure。咁你問我啦，我都想 I would like to go to some of these placements that you organizing too, Andrew. I actually visited the Western Pacific WHO office some time ago. The things that they do，佢哋介紹話俾我聽，佢哋做幾多嘢咧？真係我睇到其實我哋人類喺個門診喺個醫院度其實好細好渺小，我哋喺出面做到少少嘅嘢咧，就可以影響好大。咁即係所以希望咧，即係如果頭先我見到有同學話，即係你究竟有邊個係即係想改變呢個世界嘅話，都有好，尤其是呢邊都有好多同學會舉手。真係啲真係好想好認真咁改變呢個嘅人類嘅健康嘅話咧，呢一個科係好值得讀。咁點解除咗值得讀之外咧，就係咧喺我哋嘅醫學院裏面咧，我哋香港有2間醫學院啦，2間都不相伯仲啊，但係2間我哋都係真係有不同嘅醫療嘅學科。有西醫啦，有中醫啦，有護理啦，有藥劑啦，同埋藥理啦，亦都有公共衛生啦，亦都有我哋仲有咩啊？生物醫學啦咁嘅樣。其實我哋嘅醫學院好着重嘅就係我哋每一嘅科嘅同事同埋同學咧，都係可以走埋一齊。咁因為要一個人嘅健康，一個人有病好返，不是淨係一個醫生嘅問題，亦都不是淨係一個嘅護士嘅問題，亦都係不是淨係一個研究員嘅問題，全人類嘅問題。我哋喺呢一方面咧係做得好好，我哋係讓同學咧係可以喺各方面都會有呢個嘅認識。咁即係除咗係真係公共香港外面不同嘅醫學嘅科目，我哋都會讓同學有呢一個嘅 exposure。咁雖然呢個學科係比較新啊，但係都已經係做得好好嘅啦。另外嘅就係咧，我哋咁多嘅學科裏面咧，最多亦都係呢一個嘅 program 咧，係有外面嘅學生嚟我哋香港讀嘅。咁亦都對我哋學生嘅發展咧係好好嘅，即係我哋真係需要你去同其他人要認識、要交往、認識人哋嘅 culture 嘅諸如此類咁嘅樣。呢個係真係可以讓你好似其實真係好似去咗外國讀書咁。咁我諗我講到呢度係咁多。I'm very very sorry, Andrew and David. But I think it's useful that that we make sure that they understand how good you guys are and how good this program is, and the key to success in maintaining health and reducing the burden of disease, etc. And that is global health, public health. Thank you. Okay, thank you.
We have some time for questions. If anyone has any questions. Any questions about the program or admissions? Oh, yes. Oh.
So firstly, thank you for your sharing, and I would like to know more about the international exchange program for the GHD students. So can you share more details about it? Thank you.
So there are 2 points maybe to mention. So there's student exchange, which is something that anyone in the university can do, and a lot of our students do that in their 3rd year. That's where you spend 6 months at another university. And so that's something that a lot of our students do, and we encourage that. And I think there's a central university process for, where students go, and that's just purely academic. But our placement is different from the normal student exchange. That's professional work. So there you're actually working full time. And that process, actually, we're currently in the midst of the process for the next cohort, where students submit their preferences for where they would like to go. And then there's kind of, you submit your statement, a written statement, and then you have an interview. And then we have to try and, kind of like the JUPAS system, but for the placement, to kind of rank students where they will go. And so that process takes a few months. And usually the field placement starts in June of your final year. So just before you start your final year of studies, and it lasts for 6 months until around December. And yeah, I think any specific questions about that? It's really just a full-time kind of work experience. So your project, what you actually do, will vary. It depends on what organization you go to. So you may be doing research work, you may be, visiting refugee camps, you may be actually organizing conferences for the UN, all kinds of things. We had a student last year who was writing briefing notes for the director of the IFRC, the Red Cross. So that we were very proud of that. So you could be doing all kinds of really interesting stuff. It's like class now.
Hi, so my name is Season. So I'm currently studying IB. So I really wanted to ask, other than academic score, what kind of student or their personality are you looking at? Because personally, I don't have the best score, but I'm involved in a lot of leadership position and a lot of extracurricular. So I really wanted to know, other than your academic result, what other things are you looking for? And in the interview, is there anything you want us to showcase to you that can contribute to getting into this program? Thank you.
I can add just one other thing. I would say, in a general sense, be inquisitive, be curious. Are you, interested in how the world works and what are the interconnections and how you can make use of that knowledge? That's really kind of the underlying thing, I think, that motivates the program.
That's yours.
All right. It's kind of surprised to get questions from parents now. I don't know why. I'm a little nervous here. I never get nervous in this kind of setups. But I'm really interested in the program after hearing all that. Do you guys actually consider mature students applying? That's first. Now if there's a subjects like that, but then when I was applying college, I definitely apply. But I am working in NGOs, and I do give some career planning advice to some of the youth that I met with. And a lot of youth that I deal with now is like they have a lot of coverage. Like they like this and that, but they don't really know where they're going to. And the area that I work with the most is the SEN area, like special education needs. I'm just wondering if this program would be somewhere related to that. If just anything that might related to that community impacts and stuff like that. Yeah.
So one area that does overlap through your second question first, education comes up for us. We know that education is important in the process of development, and we know that a country's productivity and its GDP growth depends on education. But at the same time, we're interested in disparities in education. So a lot of the people who work in development are worried about the quality of education and the equity of educational opportunity. So yes, if one wanted to project from this broad platform into special needs education, it would be possible. And one could graduate with this bachelor's and then apply for a master's in the Faculty of Education. In terms of for adults, as the school director, I'm committed to opening up training for mid-career professionals in this area. So we'll be applying for a master's in global health and development program that would open up in the fall of 2025. And that would be appropriate for people who've already gotten a bachelor's degree. It's certainly, if you've got a bachelor's in this subject, you probably don't want the master's too. You want to shift gears and do something else. That's a great question. Maybe we have time for one or at most two more.
Great. Well, if there's no other questions, you guys have been a fantastic audience. Thank you so much for your attention. And we hope that you enroll in the GHD and you apply for the GHD program. Have a good day, everyone.